and the pig discussing the problems of the world. And the hen says to the pig, we must do something. The world has so many problems. And the pig says, we're only a hen and a pig. What can we do to solve the problems? And the hen says, we disaggregate the problems, take them one by one, we can solve it. The pig says, tell me how. Hen says, look, take hunger, for example. The world has so many hungry people. So I produce the eggs and you produce the bacon, and between us we'll get hunger licked. So the pig thinks for a second and says, aha, you produce the eggs and I produce the bacon, huh? So yours is a contribution. Mine is total commitment. I tell you this because, frankly, doctors, you are the pigs in this story. By granting you your medical degrees, India demands your total commitment. You are the builders of our country, which is possibly the youngest major country in the world. We have a population of 1.252 billion, the last counted, of which more than 50% are below 25 years of age. A whopping 65%, obviously all of you included, are under 35. We are not only a young country, but you as fresh graduates will be joining a dynamic, competitive, and productive workforce at a time when the rest of the world, including China, will be aging. So, the average age in India by the year 2020 will be 29. In the US by that time it will be 40. In Japan by that time it will be 46. In Europe it will be 47. In fact, in 20 years the labor force in the industrialized world will decline by 4%, in China by 5%, whereas in India it will increase by 32%. Which means we have the potential to be the workhorse for the world. We can provide them the doctors, the researchers, the service providers, the manufactured goods, if we can get that part right. We can actually have a competitive advantage, as the economists say, that no other country has. This is the time for you. You're on the right cusp of this generation. Take advantage of this demographic fact. The education you've received here will add up to nothing if you don't use the time and the age which is on your side. Dedication and passion are the keys here. The foundation of everything you do in medicine. You must invest your time in developing your skills as a human being, as well as a professional. As you exit your campus today, these trends and numbers, I think, suggest two key pointers for you. First, you join the workforce as part of the greater whole and contribute to our great nation through your individual energy. What you will achieve as a health practitioner and as a researcher will surely add to this nation's capabilities. Second, you're also the guardians of the health and well-being of this demographic dividend. Imagine a workforce of this size that I've described to you, plagued with health problems, suffering from inadequate health infrastructure, obsolete healthcare services, and rising healthcare costs. I've often made speeches about India around the world, and I often talk about the paradoxes of India. I tell people, anything I tell you about India, the opposite is also true. But at the same time, think of the paradoxes in your own field. We are the world's leading producers of generic drugs, generic drugs for AIDS, tuberculosis. And yet we have untold millions of Indians who can't afford those very medicines that we are shipping around the world. We have Bollywood, which produces 8 times the number of movies of the next largest film producer in the world, Hollywood. And yet, there are 15 million Indians, at least, possibly an undercount, who can never see them because they are blind as a result of preventable illnesses. And we have just sent Mangalyaan to Mars, but we have something like 300 million people who do not have even a basic primary healthcare clinic within a 5-kilometer walk of their places of residence. So this situation alone has the potential to turn our demographic dividend into a demographic disaster. It seems to me that it becomes part of your responsibility to ensure that healthy Indians work towards creating a healthier India. It is only then that this demographic advantage will become real. And it's significant because what matters in the long run is not merely the size of our population, but its capacity to work and contribute effectively. For that, you need health. In Kerala, our Chief Minister, who is a namesake of your director, Mr. Chandi, has this Jana Samparkam program where he goes and stands in a district capital for sometimes 18 hours at a stretch without a bathroom break. He ought to be studied by medical science, how he manages that. And he actually takes petitions sometimes from a lakh of people in a day. So after he had done all 14 districts, I asked him, what are the most common issues that are brought to you? And he didn't hesitate. 1 second he answered, health problems. Because ultimately people have all sorts of needs, but the overwhelming fundamental underlying requirement is good health. If you have money and you have no health, you can't enjoy the money. If you have a job and no health, you can't work. If you don't have those things, you can somehow acquire them through your own efforts, but to acquire them, you need health again. So health underpins everything we want to accomplish, and that is why it's so important for us. We know that poverty is one of the biggest challenges for India in the 21st century, and without healthcare, poverty will persist. In fact, in an address recently at the All India Institute of Medical Sciences, our Honorable President, Shri Pranab Mukherjee, mentioned that over 80% of India's healthcare costs are paid out of pocket. Healthcare debts plunge 40 million people into poverty every year. Can you imagine? These are shock expenses for people, the unforeseen healthcare expenses driving families into a dark abyss of suffering and poverty. On top of that, with ill health, often the bread earner is the first to be affected. The entire family suffers when the bread earner is ill. There was an article last year I read that mentioned that about 47% of hospital admissions in rural India and 31% in urban India have been financed by loans and sale of assets. So poor people who can't afford healthcare are selling what little they have or borrowing money they don't have just in order to attend to their health. We have to understand that for these people, poverty is an outcome first, a cause later. Poverty is an outcome of a health catastrophe. Most of our poor people are living just one illness away from abject poverty. You can do a great service to India by creating a buffer between these families and the vicious poverty trap. If you work in creating and broadening this buffer, you can actually also help India to capitalize the enormous potential of its human resources. And of course, as a center brimming with healthcare research, you can also, of course, contribute in due course to creating new opportunities in the healthcare sector. Our former Prime Minister, Dr. Manmohan Singh, declared the ongoing decade, 2010 to 20, as the decade of innovation. 3 years ago, I was invited by the University of Toronto in Canada to inaugurate something called the India Innovation Center. Those is the buzzword was Indovation for Indian innovation. We haven't seen enough of it. Yes, there have been some remarkable advances. Indians have invented the world's cheapest insulin injections. They've invented, in biotech particularly, some remarkable advances in medicine. But there could be a great deal more to be done in the three critical aspects of healthcare services: time, distance, and quality. They're all entwined closely, and yet each one has a role in driving a poor family from the gloomy consequences of a health catastrophe to actually being able to fulfill its potential through health and well-being. If you direct research, for example, on contracting time and distance, access and affordability, while enhancing the quality of healthcare services, we can significantly reduce the expenditure by poor Indians on their health. The scarce availability of quality healthcare services is what's driving these poverty figures. Again, turning to the World Bank, in 2012, the out-of-pocket health expenditure as a percentage of private expenditure on health in India was 86%. How does this compare with other countries? 56.8% in the UK, 32.1% in France, and 20.7% in the US, which of course is because the insurance companies pay much of it. But still, we have to acknowledge and face these realities in our country. And apart from working to change them, you should also explore new ongoing opportunities. There's so much possibility of new things happening in your field and on the stage of growing disposable income, an increasingly favorable policy environment from the government, rising awareness of personal health and hygiene. We're using TV and mass programs far better, increasing penetration of sanitation and potable drinking water. One of the reasons I accepted the Prime Minister's challenge to participate in the Swachh Bharat Abhiyan was because it's so important to have people understand the basic necessity of cleanliness in our country. And now on the back of all of this, we're seeing surge in medical tourism. We're seeing the adoption of telemedicine, the production of cheaper drugs, generics in particular, and even now the creation and adoption of health information systems using IT. However, the shift to what's sometimes called lifestyle diseases rather than communicable diseases, the growth of dissatisfaction with the government's public sector health infrastructure, rather poor rural healthcare facilities, and of course modest human resource availability in our rural areas, going on at a time of rampant urbanization, practically negligible health insurance traditions, and high treatment costs. All this will reflect the other end of the changes in the sector. So there's a lot of positive change we need to bring about while converting these negative shifts into cumulative forces of growth and change. And of course, it's not just these sort of, and I sometimes tell people every time I talk to you about some issue, we have to think of the 21st century metaphor. It's not just the hardware issues like the ones I've talked about. There's also the software issues. What do I mean by that? Like any other noble calling, and there isn't any to match yours, the healthcare profession today is also coping with a debate on ethics and malpractices. These are matters of moral judgment, where you'll often find your friends on the other side. You should not waver or worry. The dilemmas are many. The issue of psychological impact of transplants on recipients and donor families. The issues of stem cell research, authenticity of clinical trials, the use of euthanasia. There's been quite a debate last week after a young lady killed herself legally in America. Memory pills, cloning, the technique called gene silencing, artificial hearts, age retarding pills. I mean, there's so much clamor around new developments in medicine that raise questions of the ethics of medical practice. As doctors, how do you judge what is right and what is wrong? I would suggest two simple yardsticks. One comes from a Hippocratic oath. First, do no harm. That could be a lodestar for you. The second comes from my own reading outside your field. The philosopher who sought to establish ethical rules on the firmest possible foundation in the last century was Immanuel Kant, whose basic ethics principle puts forward a very simple question. Whenever you confront a dilemma about a particular practice or an action or a decision, ask yourself the simple question: what if everyone did that? If everyone doing it would be disastrous for the world, then you shouldn't do it either. That's a very useful and simple second yardstick. The simple logic works as a pretty eloquent compass in times of moral dilemmas. Ethics in any field serve as a kind of anti-clogging device that cleanses the system every now and then, lest it burst from the pressures of greed and corruption. But it's all the more necessary in medicine, where the pipe we're talking about is really the artery of the human heart and of our society. Now, ethics are easy to subscribe to in the classroom, and I'm assuming you have a course on ethics for all your students. But it's far more difficult in the real world, glittering with various inducements and temptations. These can be of the material kind: cash, fancy watches, luxury cars, exotic holidays. All of these are readily on offer to many doctors if they're willing to compromise themselves for them. They can also involve, however, the less measurable inducements of glamour, fame, the siren lure of the television cameras. I've been mortified to see this year a forensic doctor holding forth on television about an autopsy he has just conducted before he had even written, let alone submitted, his post-mortem report, just because there were TV cameras there. Now, so-called high-profile cases can bring out the worst in some doctors. But it's a 21st century problem, this. The attentions of the media and the way it turns people's heads. Nothing is more necessary than the ability you have undertaken by earning that degree today. You graduate today not only as healthcare professionals, but also as educated young Indians. You will have to face the complex challenges of the real world. There is no template to solve these real-life conundrums I've described to you. I can offer no help but to ask you to stay anchored in the fundamentals of your profession and the values that your parents and this university have so assiduously imparted to you. In these you will find the enduring answers to the puzzles of the real world. You will not only face the challenge of safeguarding the values of your profession, but you must also rise to the larger challenge of securing the destiny of India, a civilization as old as history itself. In your life as an Indian citizen, you may have to face problems that spill well beyond your professional sphere. As someone with a thoughtful mind,